Hello everyone, my name is Ravi and I work at the Royal Pharmaceutical Society. I hope everyone managed to get some downtime and a bit of rest this weekend following an incredibly busy last week. I'm doing this short video just to give a bit of reflection on my experience of working in a community pharmacy this weekend. I volunteered to work in Bridgewater Pharmacy in Watford, and I just thought it would be useful to share some of those personal reflections. In all honesty, from the bottom of my heart, I don't think anything could have prepared me for this weekend and how busy it was. I literally got to the pharmacy and there was queues waiting around the corner even before the pharmacy had opened. I must admit, I've got to praise Kathy and her whole support team for the level of commitment going above and beyond the call of duty to support people in their public, despite the challenging times and the environment that we were in. And the whole team just got stuck in, leading each other, supporting each other, doing loads of stuff, from giving healthcare advice, stocking shelves, checking medicines, cleaning the dispensary, on the call to wholesalers to source medicines, and also delivering medicines to people who were self-isolating or couldn't get to the pharmacy as well. And the list could absolutely go on. There was instance video I could cover, and I could be talking for at least an hour on my experience and how wonderful the team's response was to the COVID-19 pandemic. But I wanted to reflect mainly on few key aspects. For me, what really stuck out for me was pharmacy team safety and protection more than anything, regardless of the risks that the pharmacists or the support teams were throwing themselves into. They just did. They didn't question it, they didn't hesitate, they were there for the public and wanted to try and help as best as they could. The whole team was providing absolutely professional advice, even during these high pressure times, even though it was stressful, even though there was lots of medicines that needed to be given out to people, lots of advice that needed to be given. They remained calm, collected and professional, well organised, and tried to deliver the best form of care they can in these type of situations as well. The demand was extremely high, and as I mentioned earlier, when I talked about the busyness of it, this didn't even just go from the level of queries that were coming in, speaking to the local doctors that were still trying to run some business work on the weekend as well. It was incredibly busy. They didn't stop for a single minute, the team. Apart from a couple of me trying to make some tea once in a while, they were flat out busy. They did not stop from the moment those doors opened to the moment they closed. And even after they closed, they were still working, still trying to sort things out, still trying to get medicines ready for people to come and collect the next day. And what made me think is that there is a real risk here that sustainability of this working and this level of intensity is not going to be there. There is a huge risk of burnout and the mental health and well-being of our frontline staff being really compromised in some of these situations. And there is an absolute need to not only support pharmacy right now from a number of different aspects we're lobbying government about at the moment, but most importantly the well-being of the pharmacists, but also their absolutely vital support team. It made me realise that if one of those individuals felt sick or had to go into self-isolation, that could really compromise the delivery of a delivery of service. And it's really important that we protect and support the pharmacy teams within these current times. Secondly, the passion of delivering care for the public, as I mentioned, was just phenomenal, inspiring, and I was re-energized by the level of commitment by these professionals on the front line. Like I said earlier, regardless of the safety concerns and putting their own lives in risk, they just got on with it, working as a team. We talk about leadership and teamwork. This was a true example where books could be written about it. I would like to just personally thank Kathy and her team. The organisation, delegation, the work ethic was phenomenal. And I know this is happening up and down the country and across Great Britain in every single pharmacy team at the current moment in time. The commitment to even stay open and to support the public was just phenomenal, incredible. Thirdly, the absolute need for greater recognition. Pharmacy teams are working under huge pressure, and I saw that firsthand this weekend. There is an absolute need to boost the morale of the entire profession at the current moment in time. Pharmacies are one of the only likely places to remain open over the coming few days, weeks and months, and it's crucial that the network is supported and recognised by the government and the NHS for their absolutely vital contribution. Currently, we're asking government for a number of different things to currently support and recognise the pharmacy network as well. Firstly, we're asking to ensure that all frontline staff are protected against COVID-19. We're asking that there's adequate and quality supplies of personal protective equipment that's available across pharmacy teams, across community pharmacy, whether you're working in any other sector or area of practice at the current moment. Providing COVID-19 testing for frontline staff is an absolute priority across the entirety of the NHS, and this is absolutely prevalent for community pharmacists. I saw people still coming in with symptoms of COVID-19 and pharmacists telling them that that's not, they should be self-isolating, should be calling the pharmacy instead. But these pharmacy teams were putting themselves at risk, and it's really important that they also receive a testing for COVID-19 where appropriate and where needed. I mentioned earlier that there's an absolute need to have support the mental health and wellbeing services, or support the mental health and wellbeing of pharmacists, and we want to see all pharmacists and their support team gain access to NHS funded wellbeing support services at the moment. The second thing is that we want government to really recognise pharmacy's contribution to the response in the COVID-19 pandemic, and simply just through communications, greater acknowledgement of the pharmacy professions. I truly respect my nursing and doctor colleagues, but pharmacy has stepped up to the plate and is doing a phenomenal job to also contribute in the fight against COVID-19 as well during these really challenging times. And I would like to see greater recognition from the government and the NHS of the great work that community pharmacies and pharmacy teams across the NHS are doing. 3, we would like there to be additional funding and resourcing to help pharmacy at the current moment in time. We would like to see a newly funded NHS delivery service with new monies at the current moment. We would like an immediate cash injection for pharmacies to help improve their resilience and sustainability, to help prevent closures, improve cash flows, but also reduce the risk of any job losses as well. We would like there to be NHS funded state-backed indemnity insurance and support for pharmacists and their support teams as well at the current moment in time. These are tough times and we are having to make professional decisions in the best interests of patients, and it's really important that to support these decisions that there's appropriate indemnity funded by the state, by the NHS, or a crown indemnity insurance to cover anything related to COVID-19 service delivery. But also what we're looking for is fast tracking of DBS checks, and particularly for volunteers that want to come and help pharmacies, any returners to work or frontline practice, whether you've been working in a non-clinical environment for a number of years, but also retired pharmacists or pharmacy technicians that might also be coming back onto the front line as well. And lastly, what I also saw on the weekend was the management of medicine shortages, and it's less than ideal at the current moment in time. We are lobbying for greater autonomy of pharmacists on the front line in response to the pandemic to help manage medicine shortages a lot more better by simple switches, simple changes where needed to help maintain the medicine supply chain as well. So there are a number of different things we're trying to work on at the moment, and I hope some more positive news comes out over the next week or so. And I just wanted to say, I mean this, thank you for everything that you all are doing on the front line. You're putting your own health and safety at risk here for the greater good of the public, and it's amazing to see your guys' level of commitment in times of in such times as well. I really hope today goes okay. Please stay safe. Rest where you possibly can and look out for one another. It's all about teamwork. You all are NHS heroes. I'll be doing a little bit of a daily update later to just give you some of the developments that have happened over the weekend and that will happen today around the COVID-19 pandemic. So I'll speak to you all soon. Thanks.